Welcome to ChiroThon 2022. We could not be more excited to have the fabulous guests that we have today and you. We know you're watching virtually, and that means everything to us. ChiroThon 2022 is about elevating the education across the nation, and we're celebrating this fantastic profession, the chiropractic profession.
Need your support. And as you go through this vignette, you'll see at the bottom of your screen, you can donate at any time. Every dollar counts for us, and we're at 155,000. So our goal, 250,000. Every dollar means something to us to raise the awareness of chiropractic, and we're doing a fabulous job having you here with us today.
Number one on the streaming right now, and our first guest that we're jumping into, we're going to have a marvelous conversation about a very deep and important conversation. We have as our speaker today, Dr. John Rosa. He owns and supervises ABC Management, which is comprised of 21 integrated health clinics. So he's very well versed on how collaborative care should work. And he's in Maryland and Virginia. He sees over 60,000 patients every year. So his heart is in everything he does. We're delighted to have him. He has combined medicine, chiropractic, physical therapy, acupuncture, and why we're really here today, FCA, Florida Chiropractic Association, is a fantastic sponsor. And through this particular event, we're talking about behavioral health. What is the mental health across the nation? We know what you've been through. It could be an opioid problem. There could be all sorts of social isolation and just feeling depressed and anxious. Well, today is your day to hear more. And we welcome the chiropractors, the staff, friends and family. And of course, if you don't have a chiropractor, you can find a chiropractor. You're streaming on our site right now, f4cp.org/find-a-doctor. And yes, care is there for you. So first, we're going to kick it off with welcome, Dr. John Rosa.
Thank you. Thank you very, very much. Listening to the things that you say that I do, I cringe because you don't know where you find time in the day to get to accomplish that. But on top of what you had said, I'm actually chair of a nonprofit, same here, global mental health movement. I have my own nonprofit I started, which is Overdose Free America. I'm a surrogate to the White House for a few administrations on the opioid crisis, which has now turned into the mental health crisis, which actually feeds into the opioid crisis. So, yeah, the house is on fire and smoke's bellowing out of the windows, and it's something that we really do need to pay attention to. So I'm very glad you asked me to be here for the topic. I'm very glad to be supporting ChiroThon. In fact, yesterday I put my $1,000 in, which turned into $4,000, and it's funny, and I like to start off and I'll end by saying, the more you give, the more you get. I have donated my time to nonprofits, boards, various things. I've started an orphanage outside of Naples in Italy with my family. And the more you give, the more comes back, whether it's spiritually or socially or financially. It is really amazing. And right now, for this profession, I don't think there's a profession that sits in a better driving seat to affect addiction, especially opioid crisis,
Absolutely.
And mental health. I just, in my gut, there's no one who drives that train better. And if we could have the right messaging, which comes through what you do. I mean, the Foundation for Chiropractic Progress is constantly putting us on a pedestal to say, this is the choice. This is the right choice. You don't get that message out without support. So thank you for asking me to participate. I'm blessed to do so, and my heart and my wallet and my mind are always open to make sure that you guys progress.
Now, he said it and he really did mean it. This is an action-oriented audience, and I need you to understand that if someone is giving in so many ways, and he put his $1,000 in, and as you know, we have matching donations all weekend long. So $1 easily turns into $4, and that's really what's going to make the difference across the nation. When we start talking about mental health, and we're looking at the collaborative care, if you were to talk to, as you do in your current clinics, medical providers, and many of you are out there, and we absolutely want to work and collaborate and be a patient-centered model for you, can you tell our audience, and by the way, I have him sitting, he was with us last night. Now, if you get to see John Rosa standing, that is even more exciting. So we're keeping him well confined today in a chair. But could you tell the medical providers that may be listening, how do we effectively create a first-line drug-free approach?
Well, the pharmaceutical industry somewhat duped the system a little bit by explaining to the medical pain is an epidemic in and of itself, so you want to be able to treat it. But when the pharmaceutical industry saw that window, they pushed it through government, they pushed it through the VA, they pushed it through hospital systems, and they pushed it through doctors' offices to say, you're not doing your job if you don't treat pain. Here's an active tool for it. Now, it's not pharma bashing, it's not medical doctor bashing, because when you have a product that works, look, if I go to the hospital, I'm passing a kidney stone, if I'm not getting morphine, I'll hurt somebody. I'm a little Sicilian from New Jersey, so I get a little aggravated, but if it's made for a reason, crush injuries, if you're airlifted to a hospital, you've had a major procedure done, it should have never been used for, I was raking my leaves and I hurt my back. I was working out at the gym and I twist my ankle. I have a headache that won't go away for a few days. I had a tooth extracted. Like, there's really no reason and no proven way, in any way, that actually, those type of medications will help in those situations. So there was a quick write of a prescription where it should have been used in more active care. Like, you can't treat a symptom without treating the problem. You don't let ask any firefighter if they only treat the smoke, right? It's not how it works. You really got to put the flames out. So if you can get somebody into a system, chiropractic, physical therapy, acupuncture, whatever, behavioral medicine, because mental health overlays any pain syndrome there is, always. If you can have an approach to go after what the cause is, and this is directed to the medical system, it's always a better avenue. You're always going to get a better result, and you're not going to have somebody taking a medication that needs to take more medication. One pill, there's a 3% chance a year later you're still taking an opioid. 15 pills, there's a 24% chance a year later you're still taking those same pills. A full bottle, 30-day prescription, there's a 33% chance a year later, 2 years later, you're still taking that same medication. Wow. That's a drastic number. So for the system to understand, they should never make the prescription in the first place, because there's a slew of other opportunities. Chiropractic fits so well within that system because they're looking at the frame, they're looking at the reason that the mechanical problem, musculoskeletal problem, pain syndrome is there, and they're attacking it at the source and taking it in a treatment sense and get rid of the problem instead of just the problem I see with mental health overlay, though, and we're talking about that conversation all weekend. If I had surgery on my shoulder, I was given an opioid medication.
Okay, I'm going to stop you right there. Okay. When you said I was given an opioid medication, now we have a very amazing and eclectic audience. So we have patients, consumers, medical providers, chronic pain foundations that are listening. Many may not, like when I was going around the country, I thought everyone knew of an opiate. And when I said to one of the mothers that was sitting beside me at my son's soccer event, I said, well, we're really trying to put opioids to rest. She's like, oh, I don't even know what an opioid is. So can you give some common names that people might recognize?
Glad you say, because people think not when they don't hear that it's OxyContin. Well, you know, Purdue is in the media so much that we know Oxy or OxyContin is the big thing to stay away from. That was the voodoo pill. But what about Percocet, Vicodin, Dilaudid, morphine in and of itself, the codeines, the hydrocodone? There's almost no procedure you get done anymore without having that 15. They went from 30-day to 12 to 15 days. That was their way of releasing it a little bit by saying, we're overprescribing. You're overprescribing for an unneeded purpose, not in the amount of pills, and like I just described before. But yeah, and even tramadol is like a common, it's actually an opioid, but everybody, the way the system is explaining it, it's such a lighter version of, that it's not like in that same category. It is. And what happens is the effect of each of these pills, the brain does not like that bombardment
Right.
of chemical. So we naturally want to live in a state of homeostasis. That's what we do. We touch good, we touch bad, we have to measure out and stay somewhere in the middle. When you take any of those listed pills I just described, the burst is so high that your brain is actually saying, that wasn't okay, I'm going to tampen down that effect. So even tramadol, even though it's a lighter version, your brain still gets the burst, and you'll need more of the medication over a longer period of time, more frequently and in a higher milligram dose to get the same effect. So it's dangerous, and it's not just one name. I mean, it's easy to go to Dr. Google. He's the smartest guy in the room. Sometimes he's the dumbest guy in the room, but sometimes you can actually find something. Google, what is an opioid medication? You'll get the list, and know that when you got something, if it wasn't explained right and you're a little nervous, just look it up. It's an easy way to do it.
Absolutely. You were talking about your shoulder injury when we asked, what are some of the common opioids that people, obviously you said Oxycontin, most people will recognize that. They'll also recognize fentanyl because it's always in our news cycle. But tell me now, you're talking about your shoulder injury, you got an opiate.
Yeah, so I was prescribed post-surgical. I took it once. I felt so uneasy, nauseous, almost like upset, like physically something not right, and I didn't take it again. Bother me, which doesn't exist, but I'm giving you an example.
There's only one of him.
Thank God for that. But if I was in a difficult life situation, in a terrible relationship, I was drinking a lot, and my children don't like me, and I'm on the verge of a divorce, and I lost my job for the 3rd time in 6 months, the neurochemistry of that situation I just said, which is really mental health, this is the stuff we're going through on a daily basis. I'm not making the right amount of dopamine, serotonin, oxytocin, the normal chemicals that make me feel like a human being. I take that medication. It's not about getting high. It's about that medication not only affecting pain, it puts me in a place where I don't care about the negative stuff because I just got a burst of decent neurochemistry.
Right.
That in and of itself is the drive then to go for it again. So you got to know, if the medical system when you said there's people out there watching on that side and knowing when, where, what, how, if there's just a way to know who's in front of you, take that extra, and we do it in chiropractic all day, every day. It's a conversation. It's a deeper ask about how's your family life, how's work, tell me about the stuff you do for your activity. If the system could do that, and they'll know, I have a vulnerable person in front of me, I can't prescribe this, I'm going to prescribe this and send them out to get treatment because I know this could go down a very bad path. If that would happen, I think you would get a % reduction across the board in overutilization.
Absolutely. In fact, Adjusted Reality is a podcast series that the Foundation for Chiropractic Progress puts on, and one of the guests was Anna Lebke, and she wrote a really interesting book called Dopamine Nation.
Yeah.
And it's talking about that mental health crisis. Where do you go? What's happening? And how are we starting to have those questions that if I'm suffering, how do I get help? Do I even notice I'm really suffering with stress and anxiety? And what do I need to do? And one of the things you said that made me stop and pause is when you start talking to the doctor as a patient, how does the patient, and I know there's plenty out there, really help the doctor understand I'm suffering? And I don't know if it's because we say with chronic pain, you're twice as likely to have some mental health issues. How does the patient address the doctor effectively to ensure that their mental and their physical pain is being addressed?
Right. It's impossible to not have symptoms of mental health. Mental health is a term. Physical health, we know. You go to the gym, you work out. I know it's about staying healthy. If it's mental health, right away you want to point at somebody and say, who's crazy in the room? Mental health is just mental health. There's no way, but everybody has symptoms of mental health. It's your birthday, you just got a present you didn't expect, and you smile from ear to ear. That's mental health. That part of that symptom is happiness. But every day in the bombardment nowadays, what happens on the negative side is we're constantly being bombarded with negative. The news cycle is 24 hours. Our phone is telling us every day that what negative things are happening. You don't see the cats getting saved out of a tree by a fireman. You're literally getting, and the kids, and some even, millennials, not just Gen Z, all news is here. You're swiping right and left. We see the war in Ukraine, we see a war in Ukraine, and you see news cycles, you're like, wow, that's terrible. If you're on your phone and you're swiping one way and another, you're seeing a 6-year-old covered in a red blanket. You're seeing the negativity is so bombarded. Now that neurochemistry gets set off in such a direction that mental health symptom becomes that you're just not labeled you're depressed. I mean, you have depression, you're depressed. You're not labeled that you have anxiety, you're anxious. You're not labeled that you have some sort of a disease that label then attaches to a medication. It's called life and life challenges. Normalize the conversation. It's all the same. You're going through something. You're here going crazy on a weekend. You're doing amazing things, raising money for a great cause, educating people. Your serotonin levels your dopamine and serotonin levels are through the roof. Maybe even a little oxytocin because we like each other and there's an affection of knowing that we're doing the same thing. But it's exhausting. Like, there's a lot of stress. You're in a flight or fright response literally all weekend because you got to get it done, you got to get it done, you got to get it done. But when you go home, you take a rest, you take a pause, you do what you need to do for you to bring your system back down to normal. If you were doing this weekend every single day of your life, you wouldn't have symptoms. I wouldn't label you with a disorder, but I would say you have some anxious or depressing thoughts because your motor's burning too long. Now, as a patient, you need to tell that to your provider. Say, I'm suffering with XYZ, but man, I am just dragging. Or I haven't seen my family in 2 years. Or I can't watch the news anymore, it's destroying me. Like, the laundry list of things, like I said it yesterday in our it's like, so we have an election cycle that was terrible, so if I didn't vote for the same person you did, we can't laugh and talk about it, I hate you. I'm losing my family members on Facebook because they have a political difference than me. I'm watching TV and there's strife in the streets. I got the West Coast underwater, Gulf Coast underwater, West Coast on fire. I got a virus I can't see. I got to wear 7 masks or no masks. I had to get vaccinated 100 times, 2 times, 1 time, no time. Like, I work at a grocery store, and after my shelf, I live with my grandmother. I'm going to kill her. Like, monkeypox, and then yesterday I said UFOs. I mean, now you're going to add
UFO.
Let's add UFOs to the list of things that we got to worry about. We're not built for that. So say when you're in a doctor's presence, don't care which one it is or how. It's okay to talk to the negative process of mental health makes everyone and anyone feel like they can't have the discussion. That's not okay. Like, it's part of health. Like, you go to the doctor to talk about your weight and you're not eating right and you're not moving.
Right.
So, and there's no stigma to that. Everybody knows, well, I should probably do those things. But what about your mental health? There should be no stigma to that. We all have up and down days. Have the conversation, and it doesn't matter which doctor's in front of you. It's just some are paying attention more than others.
He said something very important, and I want those listeners out there to hear that. If you don't feel like your doctor is looking you in the eyes and having that conversation and really just giving you the 4-minute, here's your prescription, stop for a second and say, doctor, I'm not sure what this pill is. The pill itself can change your life. And if you don't have those important discussions, and if it's not with your doctor, we all love our pharmacists. They're always there to answer a question, usually with a smile. So have the important discussions to normalize mental health. If you can't do it with your doctor, perhaps maybe they're a little too busy that day, it's okay. Schedule an appointment again if you love your doctor and say, I'd like to have another discussion about what I'm going through and maybe what some of the answers are. It doesn't have to be a first-line approach to a pill. In fact, one of my favorite sayings, since my name is Sherry, we play off of Yogi Berra, is the past was a pill for every ill, the future a DC to nurture. So I want to put that out there.
Yeah, I mean, you're hitting the nail on the head. The pill for every ill Our healthcare system is just, it's a mess. Look at the opioid crisis, was just what we discussed. You gave a prescription at a time that it wasn't necessary. You may have thought you were doing the right thing. There were pill mills, believe
Medical doctors doing very bad things, but for the most part, the bulk of it was they thought they were doing the right thing. The patient needs to be proactive to know that that may not be the right thing. Mental health has happened, it's turned on its head again. There was just in the last couple of weeks, the articles that came out in the journals, there was a study in the Netherlands and in Europe, and then here they did that SSRIs, I'm sure you might have seen in the news, because now it's getting a lot of that it really doesn't do anything for depression. It's like, wait a minute, theory, the whole theory of this brain chemistry problem, that you have a brain chemistry problem. Imagine somebody telling you that and you just have symptoms of not, I mean, I'm in a bad spot. I'm out of balance, I'm not in homeostasis right now. I'm a little, especially with what I just said in the community, and they're going to tell you you have a brain chemistry problem. So it's like, oh my God, I have a physical problem. I have something going. What do I take? I got to fix this. I got to do. And now they're telling you that's not how it works.
Or fixed.
See, that was the other part of that study in the molecular psychology. Is they said we wanted to say it was genetic. Whoa! They pulled that back to and said perhaps it's not genetic. What do you do to disarm a person and make them feel bad? Blame it on their genetics, right? I mean, is that not the
best way to make someone feel like there's no hope? It's genetic.
It's insanity, because when my father passed, this, and it's not because everybody loves their father, but this guy, there was a couple of thousand people that showed up to his funeral, including a state senator. So it tells you the power and love of a human being and what he did in charity and the rest. I was not okay for 3 months. If I saw any doctor at that time, I would have been genetically flawed and had given a label of something and given a medication that was put into a theory. And now they're saying it's debunked. I loved it. Well, the theory was debunked. SSRIs are done. How do you debunk something that wasn't true in the first place? You debunk facts. You can't even debunk it because it was made up in a boardroom in psychiatry to say, well, let's call something this, give these to make a change in the brain chemistry. And they're uptake inhibitors. So it doesn't have anything to do with the ability to produce serotonin, or what are you doing in your life that's dampening the ability to produce the serotonin. It's when you produce it, let's make a drug that doesn't uptake it fast enough so it hangs out a little bit longer. Wait a minute, shouldn't we go a little upstream and say, where is it diminished from? Why aren't we? You go down to a granular level of what happens in our body, and all of it is chronic systemic inflammation at some level. That's the root of every evil there is. What is cytokine production in our bodies come from, which gives us inflammation? You don't sleep enough, your vitamin D levels are off, your diet is absolutely terrible, you're consuming terrible information which gives you some stress symptoms, anxiety symptoms, and depressed states. They produce that in your system. That wreaks havoc on the ability for tryptophan to be converted into serotonin. No serotonin decreases the production of dopamine. So there's something happening in our everyday system and body. And this is where chiropractic falls in and says, hey, you need to sleep better. Hey, let's change your diet. Hey, do you have enough vitamin D? Are you getting out in the sun? Did you move today? Are you getting exercise?
That's one of the big keys, is movement. In fact, that as we were moving through the conversation last night on our mental health panel, for those of you that weren't able to join us, it is movement. In fact, I do remember a story of an ultramarathoner who became an ultramarathoner because she was going through some very difficult, unbalanced times. And she felt that her constant movement was changing how she felt. Imagine that. Imagine exercise changing how you feel. Don't underestimate the power of endorphins and enkephalons as you go through your exercise program.
There's not enough words to explain what's available that you can do on your own. How do we have a gym on every corner? Why is it that? It didn't exist. Jack LaLanne used to stand on a chair and tell you how to do a certain exercise.
Could you tell our audience who Jack LaLanne is?
Jack LaLanne is a chiropractor, actually. And
yes.
At this point, he'd probably be 130 years old, but he was an innovator and the first TV character who actually did exercise people at home to stand on a chair. It's like all home stuff. But
He
anyway.
did, and he wasn't able to say in his
He
celebrity
wasn't able
status.
to say he was a chiropractor.
So we're
the
doing
poor
it
guy.
for him today. So God rest you, Jack LaLanne.
But from that point on, it was like, well, wait a minute, cardiovascular disease is number one. Why? We're not moving, our diets are off, we gotta eat better, we gotta exercise. Where do I exercise? How do I exercise? What do I do? What's good for me? What's bad for me? A gym pops up. Trainers are in there explaining the equipment. This is what you're supposed to do. Let me help you, walk you through it. I got this. Now you start going, there's a gym on every corner. Where's the gym for the brain?
Excellent question.
Where is the gym for the brain? The nonprofit that I sit on, and you're going to hear from Eric Hewson, the founder of it, in another vignette tomorrow. We've talked about the things that you can do, and this falls within any realm in medicine, chiropractic, physical therapy. There are so many opportunities to do exercises for the brain, and it's not medication-based. That's deep breathing, yoga therapy. That's tapping, havening. There's all these things that we can teach people to take a mental break and stimulate your parasympathetic nervous system, which shuts off all that bad stuff that's going on in the background. Every
brain, and it should not be a stigma thing, like I gotta work on my brain, oh, what's something crazy about that? No, you're a CEO of a company and you read your email 7 times and you're like, I gotta respond to this, I don't even know what I just read. You're a tennis player, you're double fault because you can't concentrate on a ball that's coming to you because something's up with you for that day. Your job is to make free throws and you can't make, you're an 80% free thrower and for the last 7 games, I can't even hit one. Okay, but there's some mental acuity stuff there. What are you doing to work on that without a medication? It's very simple. The sympathetic nervous system has taken us over in such a way that right, you're not supposed to live in that state. You know, polyvagal theory, I don't know. Einstein, if you know it well enough, if you know it well enough, and you can say it simply, well, I'm totally messing that up. If you can't say it simply, you don't know it well enough. So that's for the audience.
Just give them a 60,000-foot view
okay,
of the theory.
So you have the parasympathetic nervous system, which is rest and digest. That's when we're in harmony with each other, our space, our people, our community, and you're normalized pretty well. You feel safe. The next part of the nervous system is the flight or fright response. That's your sympathetic nervous system. And thank God we have it, because when the tiger's chasing you, you better switch over to, I don't want to look at the tiger. Is that a tiger? Is it coming close to me? Is it gonna, maybe it'll take a night. You're not thinking about that. You're like, I'm out of here. So that flight or fright sympathetic response is like instant, there's something wrong. I'm either scared. The flight is, I got to get out of here. The fight is, I'm prepared to protect myself. And the thing about it is you're supposed to come out of it and go back into parasympathetic. It's this beautiful balance of the two. The end stage is when you're too long in the flight or fright, which every day all of us are in right now. The negativity, the past 2 years, the stuff, it's a different society. There's a lot of woes. If you're stuck in there for too long, you start to move into another zone of that, what polyvagal is, and that's disassociation, disconnection, and you removed yourself from reality. That's where we see suicidal ideations, we see mass shootings increase, we see people doing things that you scratch your head and say, how? We have people committing murder and then saying, I never did it, I wasn't there, what are you talking about? And they actually were so disassociated they weren't. So those are those levels of, and what I mean by the balance is, all of us have been in a car and you look in your rearview mirror and you see the lights. Immediately your response is like, oh, is that me? I know I had my foot on the gas, like, oh my God, yes it is me, I'm getting pulled over. Here I go, like, now you don't even know, like sweat's pouring, chest is pounding, you can't even get the glove compartment, they didn't even ask for your license yet, and or your registration, you're like pressing a button, like where is it? 17,000 papers fall out, you're like, I don't even know who I am right now. The guy comes up and officer comes up and says, oh, your brake light on the one side is out. Just want to let you know. I love this car, by the way. Take it easy. Go get that thing fixed. And you're like, whew, all of a sudden. That's the example of what your sympathetic fight response is, and then the normalization of like, oh, wow, I feel okay. You're not supposed to see the lights in your rearview mirror all day, every week. You can't stay there. That's where the disassociation occurs. That's where senses of anxious feelings or depressed feelings actually will take over. So it's okay to understand that you might be in that position too long.
I think that's really one of the key points is if you're there right now, you will not always be there, but you do have to be action orientated. And as you do the action orientated parts that we're just discussing, there's physical health where you're going, you're working out, you're stretching, you're doing your flexibility, you're becoming more stable physically. You also need to do the work mentally. And that's really what the messaging is here. Action. And as we go through this talk, one of the reasons why we're doing what we're doing, and I'm very grateful to have Dr. John Rosa with us, is we're trying to raise awareness. It has to be normalized. It has to be a discussion that can come up easy. We're asking you to donate so we can have those moments across the nation to be able to showcase the benefits of what does it mean when a doctor can have you physically and mentally in balance. That's vital. It is a vital lifestyle that chiropractic brings. Yeah. And I want you to share more about when you've been through a lot of the administrative frustrations, you've been to the White House, and you may want to just tell the audience, you know, there's an alphabet soup between you and everything you've been accomplishing. Tell us some of the frustrations are that you have had to go through, and maybe some of the wins that you've had.
It's beyond frustrating because as a surrogate, as a White House surrogate, you're brought in as an expert in a siloed space. So I'm in prevention space when it comes to addiction, mental health, and then there's media, there's law enforcement, there's what your expertise is on that topic. I remember being at a meeting there, and it was actually Kellyanne being run. I just told this story earlier. She was running the meeting, and I'm 26 deep in a table, the prevention thing for this addiction, mental health, and 6 people in, the conversation was, well, Narcan in the state of New Jersey, I think we decreased at minimum of 3,000 deaths by distributing it. Another Michigan comes in and says, well, we actually give Narcan as a prescription for every opioid prescription that's giving. We just give it to them. And I think that's caused them. And another one comes in and says, we open 7 rehab centers, and we do mental health stuff, and we do addiction training, and it's really helping them. I stood up and I was like, I said, Kellyanne, excuse me, I got to go. She's like, well, you know where the restroom is? I said, I don't have to go. I got to go because I can't sit here. I probably won't even, looking at my watch, I won't even get a chance to speak. This isn't prevention. You're preventing death, but you're not preventing the problem. Everyone in this room is telling me that it's okay so long as we have enough Narcan and enough mental health medications and enough rehab centers. It's fine if we get people to be feeling sick or addicted so long as we can treat them somewhere. That's not okay. Like, we got to go way up and figure this out. And she says, Dr. Rosa, you have the room for the rest of the meeting. Huh.
Wow.
You want to talk about flight or fright? Because now I'm like, oh my God.
Okay.
Now I got to make sense. I got to actually say something that means something. So I dug deep enough and I just gave them an example. I said, I go fishing at the same hole every Sunday with my 2 best friends, an emergency room doctor and a primary care physician. It's right at a water edge, 100 feet deep. One morning, there's bodies flailing everywhere, falling over the water's edge to their demise. Before it could blink, the ER doctor's at the edge, grabbing as many as he can, because that's what he does. The primary care physician's got a raft built, and he's in the middle putting everybody on the raft, because that's what he does. And they're yelling at me, John, where are you going? And I'm swimming as hard as I can upstream, because like, they're jumping in, or someone's pushing them. I'll figure it out. You guys keep doing what you're doing.
Wow. That is a very good example.
Why aren't we up there finding out why people are jumping in? Why is, if you're 50 years old or younger, why is that the #1 cause of death is an opioid overdose? If you're from 15 to 24, why is the #2 cause of death suicide? Why is that? Not that we're going to have another treatment center or more Narcan or SSRIs for people with mental health problems. What is happening that makes that happen? You talk to people. I was in conversation with one of my colleagues, and he has a friend that's a coroner in a morgue system, and the lines of people in bags in these places are not COVID. They're people overdosed or suicide. Like lines of people, you can't get bodies there in most states. This is not a joke. How do we not go so far upstream to say, you can work on your brain? There's a gym for the brain. Just figure it out. The same here global mental health movement. Same here is the sign language of saying, you know, we all have it. Same here, like we all have that problem. There's assets out there for you to learn on things you can do. Medication for pain is our best friend. It sucks to have, but thank God you do, because if you didn't, imagine if you you put your hand in a fire and it didn't hurt. Imagine. Respect it, probably a better word. Respect how you.
It's okay to be shut down. It's okay to go in a room and feel like crap. You know why? That's the beauty of your body and your brain saying, you need a break. Take a break. Respect that symptom because it's real. It's what you feel. Also know that you're going to come out of it. That's where the problem lies. The disassociation. Like, this pain's never going away. I need the medication. I'm never going to feel good again. I got to take some medicine or sit in my bed and feel that it's not the case. It's always fluctuating. It's an interesting
thing. And
I'm not yelling at you, by the way. I
told you.
It's not your fault. It's just like,
if he was standing, we would be all over the map. So I want to really look back to what has been said and the frustrations and the wins, because you've had some tremendous moments with him here. And by the way, those who are listening, do not miss tomorrow. Wig Joe Foria, former linebacker for the Detroit Lions, a great story with the CEO and founder of Same Here. And because we've got so much happening at FCA with the mental health brought through this as a theme, and I want to thank them again at FCA, I think that's one of the critical components. When you know we can do better, we have to do better. And as a physician, whether you're a doctor of chiropractic or a medical physician, you know, as Dr. Rosa was just saying, there's need to recognize how much more upstream do we need to get. So that's a big piece of it. But one of the wins is this: when you have the conversations and you start working on the mental perspective of this and normalizing those feelings. But I will say, I've had many patients that have come to the room with, this is how I'm always going to be. That really is disappointing, because life is never stagnant. It's constantly in flux. Can you comment a little bit about that?
the win is when someone realizes life is flux. The nonprofit you spoke of, Same Here, there's actually an app. It's a scale app that you check in either with yourself, your family, or we have it in schools, 38 different school districts, maybe more by now, and the kids are using this app to say where they are on a scale. And it's an indicator for the teacher or administrator or people or families to know, wow, they've been in a not so good place for a bit, I should help. The other, and maybe just or more important, is when you're doing that, you know that I could be here one day, I could be here 1 minute or 1 hour, and over here some other time. We had a good example of it. There was a student who saw the janitor in the hallway, kind of gloom, looking down, and the student was like 9 or 10-year-old student that they had the scale in their room, even as a poster, and said, how are you today? And he's like, well, I'm, not so good, and he shows them the picture. He said, where are you here? And he's like, well, I think I'm here. It's fluctuating. I'm kind of like up and down. And he's like, come here. And they walk into the room, and there's the poster. He's like, you could be here today. You could be here tomorrow. Don't worry. and then wrote him a note and handed it to him. And in the note it said, I hope this note makes you go to the other part of the scale.
Oh.
And the guy walks into the principal and says, who did this? Like, how did this kid just schooled me on the fact that I'm going to have a better day. So knowing, even as a person individually, you got to know, I know you know deep inside, everyone knows, that there's good and bad days, and it's okay. You can't live in the good day every day. That's not how it works. In fact, it'll kill you.
It will, too much fun.
You gotta live in the bad and the ugly and the good and the sad and the happy. That's what we are actually built to do.
If we didn't need it, we wouldn't have it. And I just literally about an hour ago with a phenomenal gentleman had a conversation, and I could see the tears coming to his eyes. I said, just let it be. Just bring the emotion. Bring it, feel it, respect it.
Respect it.
Because you wouldn't have it if you weren't feeling it in your heart. And I know out there some of you are suffering, and I really want you to recognize that if you are suffering, respect that. Allow it to be okay. Take your moment away. Tears can help, but you have to know what Dr. Rosa is saying. There are better days.
Mm-hmm. Physically and mentally, there could always be a better day.
So, in retrospect, after going through the opioid epidemic and really
Made that much success when I
started doing
our drug-free pain management awareness month 7 years ago. We do a full September campaign. We've collaborated with 7 different
foundations and institutions on working together, what we recognize is one thing. It starts with upstream. And when I started, we were losing 67 people a day to opioids, and now we're at 187. And with people who are suffering from back pain, be up to 65 million a year. The last thing you should start with is an opioid, or even for that matter, a mux relaxer. There's so many more better ways, and one of them is chiropractic. To end this discussion, I want you to tell me how you see chiropractic fitting into the grand scheme of working with the collaborated medical doctors and with the patient as a big picture for success in the future.
Yeah, so you said, like, where's the wins, right? Like, you want to know, it's hard. And I'm 8 years in, and you know how hard I work in trying to get the message out and try to make a difference in mental health and addiction. And every year, and being on these vegetable soup, alphabet soup lists of government agencies that I get information on, every 3 months, it's worse. It's hard to fight and keep out there and say, but the wins are here. The wins are everybody that's watching right now to learn and understand that the stuff exists. Those micro wins turn, the ripple effect is great. The profession in and of itself, sitting in such a sweet spot of knowing I can make a difference in pain, I can make a difference in mental health. I asked in a lecture today, how many of you, there was probably 1,200 doctors in the room, how many of you have behavioral health in your clinics? Not one hand got raised up. How many of you had a conversation with your patient just doing the intake and their shoulders went from here to here because you asked all the right questions about their life and what do they do for a living, how's their family, and where did the pain come from, when did it start? No one's asking them. That's behavioral health. You lay hands on them and do an actual exam and there's that interaction. That's behavioral health. Our ability to give them exercises, change their diet, change their sleep patterns, give them like lessons on movement. And there's actual things like yoga and Tai Chi and exercises you're actually giving them. That's mental health. We don't realize we're actually hitting both. How do you make a difference? Where does that profession make the biggest difference? Knock on a door of a hospital system, a medical primary care doctor's office, pain management places, and say, I do this. My specialty is treating pain, musculoskeletal conditions with a little bit of a twist on behavioral health. I actually get them into a better place. In the past, no one would even listen. Recently, in a marketing campaign for my clinics,
I had this whole thing drawn up, took me a long time to come up with a program. I went to one medical doctor's office that saw 100 visits a day. They send me so much business, I had to stop the marketing plan because he saw and now it's only getting more. The patients are going back to him saying, where was these? Why didn't I go there sooner? What's going on? So you really got to the system has to know that's a better alternative. I got to stop writing a script for this because the stuff coming out in the science and literature is saying it's not working. But what else do you do? Don't do nothing, or giving them an NSAID and sending them home and say bed rest. That you have to understand there's a much better alternative, and that comes in the same on the behavioral medicine side. 79% of prescriptions for mental health are written by a primary care physician who doesn't even have really the education that the psychiatrist does. That's their job, is to figure out when and when not to write it. How is 79% of all those meds coming through that funnel? It's because that's where all of it gets seen. It's at the primary spot. If they would just understand that there's these alternatives out there, you could make a massive dent in this problem. And
That's exactly right.
I'm not blowing smoke here. I'm talking, there's Tipping Point. The book is a great book. 15% is that magic number. We're teetering on it. Some places it's at 15%, but others it's more like 7, 8%, so it's a weird average. 15% of a population uses something. If there's widgets made and 12% use it, you got one factory. As you over 50, in fact, everybody wants the widget. We need the medical system to understand that these have the keys. The door that's locked to pain and mental health has like 10 locks on it. We have like 8 keys. How are they not letting them come to us?
That is one of the big keys, no pun intended, to why we're here today. And for those of you that would like to learn a little bit more about the mental health aspect that Dr. John Rosa had discussing, please do go to samehereglobal.org, and you will actually learn a lot more about how to work that mental gym. And I also want to remind you that we will be having another vignette later this afternoon
at 2:40, and it fits really well into our conversation here, and that is we're going to be having Dr. Jennifer Wiles, fabulous title, it's Having It All. It is a health, vitality, and energy panel, so I'm throwing that in right now. And before we end today, I'm going to ask Dr. John Rosa one last question as we move through, because he talked about his wins. What are the keys? And I want him to talk about one last piece. I want you to inspire, motivate, and encourage the consumers out there that may not have a chiropractor, that may not have an avenue right now that really does assist them with their mental health. What do you say to inspire those that are suffering right now, that need the help, but not sure what to do or where to go?
Your website actually has an incredible list of chiropractors that are across the nation.
www.f4cp.org/find-a-doctor. Thank you so much, Dr. John Rosa.
I mean, it literally is it's a great pool of places to go. You will be pleasantly surprised. Just reach out and make an appointment. I mean, there's no reason to suffer, whether it is for behavioral issues or for pain issues, because they always coincide, always. You can't have a pain syndrome, whether it's acute or chronic, and not have a mental health overlay to it. It's literally impossible. The same area of your brain, the chemistry in your brain that controls pain, also is all the emotional pieces that we suffer with. And they communicate all day long. Just understand that it's okay, you know it's there, and there's people out there that will not put you on a path. There is a light at the end of the tunnel, and it's not a train.
That's right, it's not a train.
So just make an appointment. You'll be every single time I'm done with a new patient that is chiropractic naive, meaning it's the first time they've seen them, the statement is always the same. Why did I wait this long to get this appointment? Why didn't anybody tell me that you exist? Why didn't my primary care physician send me to someone like you? Why doesn't anybody know? My family, I even asked, and they were like, I don't know what that is. I don't know. I hear they do some kind of crazy whatever. Like, trust it. Please me, trust it. Make an appointment. It'll be the best decision you've ever made.
Action-oriented audience, and I want to thank all of you. While we've been here with Dr. John Rosa today, we've already gained $3,000. We're now at a goal for our 250,000. We're now at 158,000. Thank you. Thank you to Dr. John Rosa. It can't happen without you wanting to make a better world. And it's all of us together. When we all come together to make it right, the world changes. So I thank you for joining us today. Dr. Sherry McAllis with the Foundation for Chiropractic Progress. Don't forget to join us. A fantastic vignette coming up that is with Dr. Jennifer Isles at 2:40 today. The title says it all. It is Having It All. Health, vitality, and energy. Because it's Dr. John Rosa, I am to give him the last 1 minute as a good doctor.
Courtesy call. I was trying
Take
to
it, Dr. Rosa. You got your last minute in.
All right, you say, what are your wins? What's the wins? You're at the highest level. You go to the White House. You consult for Homeland Security. Those are not wins. Those are expertise pieces. The wins are here. The wins are the messaging. The wins is every single person who's watching right now, that if you like what you heard, or you heard something slightly different, and you know you should go after it, or you know, wait a minute, that made too much sense, I should say something. Say something, tell somebody, get more involved. If you're a doc, do more about it. Spread the word that you're doing the right thing. If you're in the medical system, refer more to the people who can make a difference. If you're an individual who has never heard this before, please just try it out. Know that that's there. And give back. The only way this works is if more and more people get a chance to see it and understand and hear it. That's what the foundation does. They spread the word for us. That's when if you're an individual, a corporation, a doctor, and you want to know what he made too much sense, why doesn't everybody hear about it? If you can't support a place that actually billboards this for us, that's a problem. So do what you can, give when you can, because that's literally what I live by. Thank you.
Awesome. And share with friends. My own personal experience was I never tried chiropractic and I was sick with trying it well. I was sick from the pills, tried to get well, and did not expect to end up being a chiropractor. Not a day goes by where I would have chosen any other career. Most impressive, exciting, passionate job I've ever had. And I will tell you, in a physics room with a man that slid a card across the table and he said, what do you have to lose? And I tried chiropractic. So thank you for being here. Look forward to having you join us the entire weekend long. All the best. See you soon.